The best practice guidelines are a set of guidelines that were put together by the ACS NSQIP, and they're meant to be concise, evidence-based, expert panel-rated guidelines to prevent the most common post-operative occurrences and complications. The guidelines were developed by one of the ACS clinical scholars in conjunction with a lead expert in the field. The drafts of the guidelines were then circulated through a group, an expert panel if you will, that was again culled from people well known within the field with respect to that specific occurrence. That expert panel then provided what we call clinical utility ratings that basically validates how useful or how important each of the recommendations is, and then all that information was then consolidated into the final end result. These tools are currently available online at the ACS and NSQIP sites, and they can also be available in print form from the ACS. The topics that we've covered so far include surgical site infections, prevention of venous thromboembolism, prevention of UTIs, prevention of catheter-related bloodstream infections, prevention of post-op pulmonary complications, prevention of ventilator-associated pneumonia, and we're currently working on the prevention of renal failure as well as perioperative management of the elderly surgical patient. The guidelines are organized in a fairly standard order from guideline to guideline to provide continuity. Probably one of the best examples is the prevention of surgical site infections, and the way they're organized is that they start with a background section that provides information about the clinical and economic impact of that specific post-op occurrences. We then go on to a section to talk about risk factors associated with that occurrence. And really the meat of the guideline is a set of basic recommendations that we feel every participant should be following. These are evidence-based, tried, true, and tested, if you will, followed by a section of special recommendations that if you've tried and you're doing all the basic recommendations, you may wish to consider if you're still having problems with that specific post-operative occurrences. And then finally we have a section on basically steps or techniques that are no longer recommended, that are not supported by the medical literature, and those are a lot of things that have become surgical dogma that we really need to try to shy away from. Within the recommendation section, both within the basic and the special recommendations, they're organized chronologically, so there's specific steps that you may want to take before, let's say, an invasive catheter is put in, such as a central line or a urinary catheter. There's steps that you may want to follow during the placement of those devices, and there's steps that you may want to follow after the placement of those devices. We also have them organized by patient-related, provider-related, or healthcare system-related as pertinent. The guidelines are also accompanied by a fairly extensive list of references so that if physicians or nurses at the NSQIP sites want to learn more about the literature behind each of those recommendations, they can refer to those references. And finally, we have a list of appendices, which is basically meant to be sort of a set of tools that the surgeons and the nurses at these sites can also use to try to implement some of the recommendations in the guidelines. I think that there's certainly a plethora of guidelines out there. A lot of them are quite long, they're fairly complicated, they're sometimes conflicting. I think these are really meant to be concise. They're meant to be pocket references, if you will, so that nurses and physicians and QI professionals at each of the sites can rapidly and quickly get a better handle on what may be causing these occurrences, how to prevent these occurrences, and how to implement rapid change.